Hello and welcome to Docplexus News. Let's discuss this week's healthcare headlines that matter. The Union Health Ministry has released a set of 50 FAQs on the National Medical Commission Bill owing to various objections regarding the bill. The FAQs are provided for better understanding of the provisions of the bill and the intention behind introducing these provisions. Around 10,000 doctors held a protest march from AIIMS to the Parliament House against the NMC bill. The march was held to show opposition to the various provisions of the NMC bill that seeks to replace MCI. The doctors also opposed the bridge course that allows alternate medicine practitioners to practice allopathy. Undergraduate AYUSH aspirants of Karnataka will have to appear the NEET examination from this year. The Karnataka Examination Authority has notified that the candidates who wish to seek admission to AYUSH courses must compulsorily appear for NEET 2018 and not CET. Scientists from Imperial College London have developed an affordable and highly sensitive paper-based test for early detection of HIV. In this technique, if the patient is HIV positive, the virus component will bind to the colored particles on the test paper. This test can also be used for detecting other dangerous diseases like Ebola and Zika. The FDA has approved Lootatan 177 dotatate for treatment of certain gastrointestinal tumors. The drug binds to somatostatin receptors to deliver radiation directly into tumor cells. The FDA approval is based on a clinical study involving 229 patients which demonstrated that Lootatan dotatate lowers the risk of tumor growth and mortality. The Maharashtra FDA is set to implement the new medical device regulations. The medical devices have been categorized into 4 classes based on the intended use of the device and the potential risk associated with its use. This Medical Device Rules 2017 is going to replace India's Long-Lasting Drugs and Cosmetic Act upon implementation. The government has announced that existing 9 government hospitals in Arunachal Pradesh would be upgraded into e-hospitals. The National Informatics Center is directed to fast-track this procedure and active support is sought from the state and central government. The Railway Ministry has signed a Memorandum of Understanding with the Ministry of AYUSH to expand the AYUSH system in railway hospitals. The health services by AYUSH would be scaled up to 5 railway hospitals at New Delhi, Mumbai, Kolkata, Chennai and Guwahati. This move is intended to ensure the wellness of railway employees. Infection due to needle stick injuries is a matter of concern among healthcare professionals. A recent report revealed a shocking fact that over 500 patients in Maharashtra contracted HIV via infected needles in last 5 years. This week, Docplexus shares some useful tips for the community to prevent such infections. Doctors can reduce the risk of infections by minimizing the use of needles wherever there are other safe alternatives, disposing the used needles in clearly labeled and puncture-proof containers, ensuring proper training of staff on the safe use and disposal of needles, and following the device safety features. Please share your tips with your fellow doctors for preventing needle stick injuries. These were the latest happenings in the medical field brought to you by Docplexus, India's largest online community of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexing!